I'm Dr. David Hurwitz. I'm an internal medicine doctor with a subspecialty in geriatric medicine.
I'm Jessica Colburn, and I'm a primary care geriatrician in the Division of Geriatric Medicine and Gerontology at Johns Hopkins University School of Medicine.
When I think about the most important challenges for the health and care of older adults, my top three would be aging in place, chronic disease management, and then the assessment and treatment of cognitive decline.
Technology can help to provide solutions that support older adults who want to stay independent at home.
These technologies include things like remote monitoring technologies, medical alert systems, camera monitoring, vital sign monitoring, smart home technology. Most people in their 70s or 80s or 90s will develop chronic medical conditions, ranging from wear and tear conditions like arthritis to organ dysfunction, so heart disease, kidney disease, diabetes.
Technology could help older adults with managing chronic disease, with recording symptoms that physicians or other specialists need to know about.
Perhaps most importantly, using new AI technology to help us develop diagnostic capabilities that go beyond even what a well-trained doctor can offer. For example, critically analyzing the thousands of studies that are published every week, or culling electronic medical records to find a diagnostic pearl somewhere like a needle in a haystack.
We often see that older adults, as they're losing their memory or having more struggles with their memory, that they need help with reminders or preparing meals or other supports for adjusting their medications or doing things they need to do at home.
Sometimes we don't identify those cognitive changes for many years. AI technology can help with that, to identify progressive dementia versus what we would call acute delirium, so significant changes that are reversible.
Technology can potentially help to address social isolation and provide connection to families or friends or hobbies or new experiences for older adults. One important consideration in the design and development of technology that's intended to help older adults is whether it's accessible. For instance, do older adults have the technology or internet that they need? Do they have trainers or coaches that help them learn how to use this technology?
I think solving a customer need in geriatric care is definitely going to need to involve different stakeholders with different knowledge levels and different interests.
User-centered design is so important that older adults and their care partners really have to be at the table, have to be involved in thinking about what they want, like what will work for them, what they'll use. Additionally, I think accessibility is really important from a physical or functional or cognitive standpoint. So an older adult with arthritis might not have the fine motor skills to open bottles or to use technology that has small buttons, for instance, or older adults who have vision or hearing impairment might not be able to access the technology in the same way if they can't see the color differences or they can't hear the pieces that they need to hear to be able to track the next steps for what they should do. Many older adults might not be able to afford it or might have cognitive or functional limitations that impact their ability to use the technology, and they may have difficulty with internet access or a coach to help them learn, and those things I think really could create barriers for them.
While, of course, in any demographic there's a spectrum of early adopters to late adopters, there's a spectrum of interests and knowledge. For the most part, within my patient population, there's not a lot of early adopters. Many of my patients have a fear of technology.
I think people worry that a device or other piece of technology is listening to them or recording them or might have access to their personal health information, and so we really have to keep that in mind.
I think another major barrier that needs to be considered is the cost and reimbursement and overall business model for the product or service that's being developed. To give an example, in the United States, Medicare and Medicaid, they will pay for certain technologies. They pay for certain kinds of what we call durable medical equipment. But all of these require very specific certain diagnoses and documentation to be covered. And many new technologies, in my experience, do not necessarily fit into a reimbursable diagnosis code. So it may take time for a truly disruptive innovation to be reviewed and adopted and accepted.
And facilitators to older adults' adoption of new technology, I think, include coaching or remote support to make it as easy as possible. Also, I think it should have clear value or benefit. People should be able to see why they want to invest their time into learning to use technology, how it can be most helpful for them. And so I think it's more likely that older adults will consider different types of technology and use them if they're straightforward, easy to access, and have the right supports in place for them.
I love geriatric medicine because I find it deeply personally rewarding to help my patients and their families find and maintain joy in aging. So for that reason, I hope that innovators will find an opportunity and a joy in serving the older adult population, because ultimately it benefits all of society.